So you want people to come in not just for the check engine lights, you want them to get their oil changed.
Correct.
Yeah.
So many times.
Once we get to the realm of symptoms, problems have been there and they've been there for a little while.
Yeah.
And so it's much easier to help create fireproof systems as opposed to we have to put out the fire first and then work backward.
Welcome to the Invigor Medical Podcast, where we sit down with medical professionals and discuss a full spectrum of health-related subjects. It all starts in 3, 2, 1.
Welcome to the Invigor Medical Podcast. Today we're excited to have Dr. Dan and Dr. Lindsay join us on the podcast. They are experienced chiropractors with a passion for helping people improve their overall health and wellness through their practice, focusing on spinal health. Dr. Dan, Dr. Lindsay, welcome to the show.
Thank you so
Thanks
much for having
us. Appreciate it.
So just to start off, you guys are chiropractors. What led you to want to become chiropractors?
Well, as a 16-month-old infant, I ended up at the Shriners Hospital, and they weren't sure what was going on. So they did some testing, figured out that they think it was juvenile rheumatoid arthritis. So I grew up in a medical hospital situation for a while and was checked yearly after that. Went into remission, all good things from there. But it spurred my interest in medicine at an early age and in science. Went all the way through college thinking I was going to go pre-med route, did the MCATs, all of that. And then I decided I don't want to be around sickness all the time. So then I looked at some other options in healthcare that really is more about health and wellness and vitality versus dealing with the repercussions of sickness.
Right. Dealing all the what's happening and rather sort of more preventative care.
Right. Exactly. Yeah. Yep.
Now, were you both this is what I'm curious about because I still want to hear you guys. Is it like you met at school?
We did.
Okay. I'm did you a couple and then you're like, let's be chiropractors together?
No. I'm from Washington. He's from Ohio. We met in Iowa at school.
I'm
Indiana.
I
know, right?
Yeah.
Chiropractic for me is it's kind of a family gig. And so I have a cousin that's a chiropractor, amazing chiropractor that I was able to start, kind of being a patient as when I was in junior high. And it's all I ever wanted to do. Besides, it was either go to the military or be a chiropractor. Yeah. And I was really fond of being the boss. Kind of.
Kind of, yeah. Then you got married.
But we love the fact, and I love the fact that as a chiropractor, we're also entrepreneurs. And so we're able to help people do it our own way, but then also run a business and be able to do things that way too, which we love that side of things. When it's just us making decisions as a couple on how to best take care of people.
That's super cool. And how fun. I was just talking with my sister the other day about how it's really cool when you can find someone to be a partner with that your dreams align and where you're going together that's such a fun feeling. How long has it been now that you guys have been doing this together?
We opened our practice 10 years ago in June. We both worked for other doctors in Ohio first and then moved out here back where home was for me. Well, Washington was home, not over here. And then we ended up opening in June of 2013.
That's so exciting.
It's really been an amazing journey.
Been? I imagine it's been kind of overwhelming at times and...
You know what? It's definitely when you start a practice together from scratch. I mean, we moved across the country from Ohio in 2013, and
we knew one person.
We knew one person in the Tri-Cities, and
that feels familiar. Yeah, sorry.
Yep.
We built a plan. We vision planned together. We knew this is what we wanted, and we went set to open our practice. And then a month before we were set to open our practice, we found out we were having our first baby.
Oh my gosh!
So we were like, let's just chips all in. Let's do it all.
Let's do it.
Yeah.
Go for it. I like it.
He's like, I got family to support now.
100%.
So it's been fun.
It's been, which is why we're so passionate about families because, it started out for us about kids and babies and families because that's where we started our journey.
She came to work with us every day.
Every day and was underneath the front desk and our patients held her from day one and they've held all my kids.
It's been fun.
It's been super fun.
Yeah.
Awesome. Yeah. So focusing in, chiropractic care, I think is something that a lot of people know about, but they may not know the full benefits of what it can do for their body. Can you dive in a little bit more into that and why is chiropractic care so special?
Go for it.
Yeah, game on.
He's buckle up.
Here we go. He's the talker.
Well, and it's especially, and this is something I'm super passionate about explaining because most people, when they think chiropractic, they think spine. They get stuck on spine, vertebra, bone adjustment. Where the power of chiropractic comes when we focus on neurology, when we focus on the nervous system. And the only reason that we ever go in and provide an adjustment is because it's the only way that we have an in to talk to the nerve system. Yep. And so the brain and the nerve system is what basically your life experience and tells your body how to experience what you're doing in life. And when that's not able to function to the fullest of its capacity, that's the only reason the brain then has to warn us with symptoms and issues and problems because it can't understand how to adapt to you at that point. So our end to be able to help people experience life better is all about teaching nerves what to do.
That's a really cool way to describe it. I mean, I've done chiropractic care pretty much my whole life, and my parents are always into it. I remember after my mom had one of her babies at home, which we were talking about home birth before we started recording.
Yep.
I remember our chiropractor of years came with his table to my parents' room to adjust the baby, my mom, and then like all this other little kids. He's like, guys, get on up here. And we're like climbing up there for these adjustments. But despite all of the experience that I've had with it in my life, I don't think I've heard it described quite that way. So that's I love that perspective.
Yeah, there's absolutely that structural perspective. And then there's also the nervous system perspective as well. It's kind of a combo platter.
Yep.
Yeah.
Well, and that's something we talk about a lot here, the sympathetic nervous system, the parasympathetic nervous system, what's going on in our bodies, like the brain and body connection. And so I'm really excited to expand more on this conversation because it's like a lot of what we want to try to do is give people all of these different ways to understand what's happening in their body and how to live a full, healthy, happy life by taking care of everything that's going on.
Yeah, absolutely.
Yeah. So that being said, is there, because I actually hadn't ever thought about it in the terms of like the nervous system either. And so being able to frame it in that way is really cool because, everything goes through the spine. And so I know you said it's not necessarily about spinal health, but I mean, it's essentially the thing that encases everything else and that sends the messages out to the rest of the body. If I'm summarizing kind of what you're saying there.
Absolutely correct. And the reason why chiropractic has an into the nervous system is through the spine is because the motion and the alignment of that spine, when activating appropriately, fires the receptors to be able to teach the nerves again so that they can signal appropriately. When you don't have that normal spinal movement, those receptors are not going to fire appropriately. And therefore, we're going to do nothing but then allow that fight or flight sympathetic side of the nerve system to go into overdrive. Yeah. And when that happens, the most important side, what we love, that parasympathetic side of the nerve system gets downregulated at that point too. We can't get that, calming, rest and digest side of the nerve system to allow our system to function appropriately. Those two sides are definitely inversely proportionate.
Yeah.
So that being said, what are the most common issues that you see when someone comes into you for chiropractic care? Like, what are the things that cause issues to crop up with the spine?
Sure. So most adults are still coming in for back pain, neck pain, headaches, those sorts of things. The structural old school, that's what we thought chiropractic was. And it definitely helps with that. I mean, obviously we need our body to be functioning well. We need our spine moving well to turn off those indicators of, hey, my body's trying to send up a red flag saying something hurts, there's inflammation, there's muscle tension, all of that. And then for kiddos, we're seeing now more and more adults are coming in for things like gut health, heart palpitations we're seeing sometimes, brain fogginess. For kiddos, it's usually colic, reflux, delayed development, behavioral stuff. If you think about just their nervous system wound so tight. And so we're trying to unwind that nervous system by making sure everything has the stress off of the spine.
Gotcha. So you want people to come in not just for the check engine lights. You want them to get their oil changed.
Correct.
So
many times.
Once we get to the realm of symptoms, problems have been there and they've been there for a little while.
Yeah.
And so it's much easier to help create fireproof systems as opposed to we have to put out the fire first and then work backwards.
And that's where medicine comes in and is helpful. Is there are times that we do have a fire going on in our system and we need that fire department to show up and take care of the fire first. And then it's more of rebuilding that system into a healthy system where, especially with kids, if we can get them early enough, especially we see kids right after birth sometimes, we'll go to their homes as well and adjust right after birth at times, getting that stress off the system just from birth. I mean, if you've ever seen a birth, it's hard work for everybody. It's like it just is. And I'll have
just everything squishes.
Yes. And I have so many moms are like, how come my baby really prefers this side? I'm like, well, where were they in your belly? They were like right here for the last 20 weeks. And I was like, exactly. They were in that position for 20 weeks. Like that's a long time to hold in one position. And then you have birth after that. So it's really interesting to just get a hold of it early and build that body healthy. Yeah.
Well, and I think one of the things that we talk about is like usually taking charge and taking care of your overall health and wellness can oftentimes feel like something that's completely overwhelming, right? And being your own advocate in health. And there's so much information. Like on one hand, it's wonderful to live in this age of information. Right. We have so much at our fingertips.
Yeah.
On the other hand, it's like, holy crap, where do I start?
Yeah.
Right. How do I take care of me? Is this relevant to me? It worked for my friend. Does that mean it's supposed to work for me? Do I need something different? And so I always love whenever we have ways to, it's like you could go and do this one thing and it's going to help you feel better. Like it's not even about we're overall trying to diagnose this big thing, which it can lead to that. But it's like, hey, if you haven't, like not just because you're feeling back pain. Maybe you feel okay, but you just know something's off.
Mhm.
You're constantly bloated.
Mhm.
You're having brain fog. You're not sleeping well. Even if
Mhm.
you are sleeping a lot, you still feel really tired.
Mhm.
You're having skin issues, all these allergies, things like that. It's like,
Right.
go see a chiropractor.
Yeah.
Start getting adjusted regularly and see what improves, right?
Right.
Because a lot of people don't think of it like that. What you're saying
Mm-mm.
is they're like, my back hurts, my neck hurts. I'll
Right.
go get adjusted and then I'll come back, which
Right.
I've been guilty of too before. I just haven't gone. Like,
So have we at times,
and
right?
then it's like, oh, I hurt again. I better go back in 3
Right.
months
Right.
later.
Yeah.
And it's not that that's not helpful, but what you're saying is there's so much more.
Correct. And
that-
that's what they see afterwards. Like I'll
Mhm.
take their intake paperwork and I'm like, okay, they're here for headaches or whatever the thing is. And then you'll look at their like review of systems and they're like, and I have all of these other things. And then we check in with them at re-exam times and they'll be like, I noticed I actually am sleeping better and I am more productive and I am able to do all these other things that they weren't even initially there for, but we see it happen all the time.
That's awesome.
Mhm.
Right.
Yeah.
That's great.
Yeah.
So a question that I had is, whenever I go into the chiropractor, it's kind of like, all right, I'm going to get the pop rocks on my back. I'm gonna get to hear
Yeah,
all the-
yeah.
I get to hear all the
Right.
fireworks, and then
Yeah.
all of a sudden I magically feel better.
Right.
Right.
Can you go into a little bit of like the science of like how does chiropractic care actually work?
Yeah.
Like I know that you mentioned the nervous system, and like I'm guessing it probably has something to do with the vagal nerve system.
Yep.
Mhm.
Yep. Could you kind of dive into that a little
Oh,
bit more?
I'd love to. And I think the most important step that we need to talk about when it comes to how things go in and actually enter the conversation to the nerve system, it has to start with diagnostics first.
Mm.
Like most people think we're going to hop on a table, we're going to get adjusted, life's going to be
Snap,
wonderful.
crackle, pop.
Mhm.
See you later, guys.
Exactly. Exactly.
But it's so much more in depth than that. We have to get an idea as to what state the nerve system is in first. So one of the most important things we do in our office is we do complete nerve scan studies on our patients before we ever get started. That allows us to see what the autonomic nerve system is doing, the balancing between sympathetics and parasympathetics. Then we want to see what the brain is telling musculature to do through motor nerve activity. We take nerve scans and we see how patients are able to deal with their posture within gravity. We do HRV testing. If you've ever heard of HRV testing,
I
it's
haven't.
awesome. It looks at, again, balance between sympathetics and parasympathetics,
Okay.
but then it also looks at the reserve capacity of the nerve system. Is it tired and exhausted, or is it ready and able to adapt to new stress loads that come in? All of those things have to be looked at before we can ever determine on a patient what needs to be adjusted. And then we can look at that based upon symptomatology and x-rays that we do too, and what the structure is doing, and go, okay, cool. Now we know what the next step is for that nerve system
What
in
the
terms
plan
of
of
what it
attack.
is. 100%.
Mhm.
It could be an upper cervical work that needs to be done, which is massively important for vagal innervation. Or if we have a baby that's dealing with massive digestive tract issues or colic or tons of reflux or constipation, and we go, okay, cool. Based upon where that nerve system is not adapting us appropriately, do we need to start at the top or the bottom to make sure that we have proper input for that? But again, when it comes to actual adjusting for kids and adults, very, very, very different. We have to adapt for ages. If we're looking at a brand new sweet little baby that's just coming to us, that's maybe only a few days old, that's not sleeping very well, colic and reflux, it's going to look like we're just holding our hands there because they don't have bone structure. They don't have
Right.
muscle mass like we would as adults. Where adults, they need a little bit more input in order to make sure that those things are able to be accomplished.
Right. I'm guessing
So-
people listening, if they've never heard of a baby being adjusted, they're like, imagine
What are
like
you-
baby laying there, like, grab your head.
100%.
Yeah,
Like, I literally held my baby on the shoulder and I just, chiropractor just kind of like
Oh, yeah.
felt upper spine,
Very
like
gentle.
you really wouldn't have even known anything was
Mhm.
happening.
Yeah.
But
Oh,
I
yeah.
can imagine that people that aren't familiar might be like,
I
Yeah.
love watching dads when they watch babies get their adjustments for the first time, because dads, they always, not all dads, but some of us, we
Yeah.
hover in the corner with that look like, dude,
You better
touch
watch
my
it.
baby.
Right. You make that baby cry.
Uh-huh.
And then we get done and we're working with these babies and it looks like we're just setting our hands there and doing what's necessary. And all of a sudden we get done and dad's like, that it?
What'd you do? What am I paying you
He
for?
goes, okay, we're cool now.
Yeah.
So-
Yeah, it's interesting because it's really just more about getting the right input into that system and the unwinding. So the adjustment, when we get the adjustment happening, you get a little bit of endorphin release. You get the body to turn off those signals of the pain, the stress, the inflammation signals, and the wound up nervous system. You're just getting it calmed down.
So it sounds like to me, and this is something that we've covered on the podcast with previous guests as well, where it's kind of like we just live in a society where things are just strung up too high.
Yes.
Like people are just working too hard, pushing them too far,
Mhm.
and we're getting all wound up.
Mhm.
And that chiropractic care essentially is a way to help people unwind Which I know in your clinic, you also have massage therapy. Is that also kind of the role massage therapy plays and like tandem with chiropractic care?
Absolutely. It depends on what's going on. So we have 3 different massage therapists that do 3 different very different techniques. So one is a deep tissue therapist, works a lot more with injuries and those really tight, tense muscles. We have one that more is structural integration, so helps kind of relax all of the musculature kind of overall throughout your whole posture. And then we have one that works a lot on our prenatal patients. And so she's working to really help mama feel better, but getting lymphatic flow well, making sure that the swelling and things stay down, making sure that everything's aligned and as gentle and relaxed as possible for a birth. And then, when we're looking at everything together, it is all about those stressors. I mean, we talk about stress all the time. And so we talk about sometimes when we get done with the care plan and someone hasn't yet really unwound all of the parts of the nervous system, we start talking lifestyle. We're like, what are you doing outside of here? What is that stress? Is it home? Is it what you're eating? Is it your environment? What is going on outside of here? Because we're all so strung up all the time. It feels like in America.
All the time. And I'm like, if somebody wants the 25-second elevator pitch, about chiropractic, it's like we live in the land of engaging the parasympathetic nervous system all day in patients. That's what we do. Why? Because we live in such a chronically stressed out lifestyle in America where all we do is stressed out art, because it's the next, okay, cool, it's today, we got to get the kids to school, and then we got work, and then we got 18 sports activities in 3 different cities for all of our kids. All we do is go, go, go. The first thing that goes, exercise and nutrition. At that point, we're stressed out all day. We joke about it because we talk about sympathetics and parasympathetics in our office like gas pedal and brake pedal. Is we live on the gas pedal, Porsche cruise control 80 miles an hour all day, where our systems are craving to just pump the brakes. And we'd spend the entire day literally just helping patients pump the brakes of their body to slow their system down. Doesn't mean you have to slow their lifestyle down. It means to slow their physiology down so that it can catch up and adapt and keep up with them.
Right. So they're not living in a constant state of alarm
100%.
and like reactivity. Yeah. I love that.
Yeah. So are there any specific protocols that, besides chiropractic care, are there any specific protocols that you would suggest to help people press on that brake pedal, to help them kind of like relax, whether that's like a 15-second thing or if it's something that they can do over the course of a couple minutes or an hour? Like what are your guys' go-tos?
As far as home stuff. You can take it, go for it.
I have my go-to. I mean, for me personally, my go-to every single morning is on my way into the office is sauna time. And sauna time for me is 4 square breathing when I'm in the sauna, where I'm doing 4-second inhalation, 4-second hold, 4-second exhalation, 4-second hold. And I'm in there absolutely as long as I can. And like that is my way to start the day, where I can calm my system down. I prep my day, I prep my mind, I get myself into a brake pedal state so that I'm able to help get other patients into that throughout the day. So that's my daily. But even a little bit more broad than that is people have to move every day. And I'm like, it's not even, I'm sorry, but it's not even an option. Like we have to move every single day in an intentional movement way. Not like, oh, I'm running because I'm taking kids everywhere. No, we need to have that intentional, whether or not it's a 30-minute walk or something once a day to help just keep your system moving. That's one of the best things that we can do. That unfortunately we need to start building as a non-negotiable throughout the day.
Right. Yeah. I found that whenever I go I go for long walks or hikes, it's very different than running around with the kids, because it's like, it's just me and my thoughts. It's just me and my mind, and I'm just walking. I have that time to really unravel. So I totally agree with that.
Yeah. You really would love a cold plunge too. Let's be real, but we're not.
I'm trying to figure out how to get one from my garage.
He's trying to build one.
Okay, can we do a behind the scenes episode where I go to their house and we figure out how to learn? Because I want to build one.
Yeah, he's all into this.
Is the best.
I think the more we're going to learn about cold plunging over the next few years in research, it's going to catch up. It's going to pass sauna. It's going to pass everything.
Insane.
And it's a fraction of the time that you would need to do those other things.
And people say I'm crazy. I started like 4 years ago.
Wow.
I started trying cold showers. I don't even remember where I heard it. And I worked my way up to 3 minutes and people thought I was nuts. And then I started rolling in the snow in my swimsuit. And then it probably was 2 years before I jumped in the Columbia in January.
Yeah.
And yes. And it was and I didn't even do cryotherapy till last year.
Okay. Yeah.
What was funny is I so much preferred the river. Cryotherapy was cool, but I did not feel as impacted by the cryo as I did by the river. When you're in the river for 3 to 5 minutes, it's like That's huge.
Mhm.
And you really do have to work your way up. But like the cold plunge in the morning,
It's
the
awesome.
dopamine hit, like I was just
Mhm.
talking to somebody I work with a few months ago who's had one in his garage for a long time to help with anxiety and depression. And he got on a FaceTime with me for some kind of work meeting. And he was like on one. I don't think I've ever seen him so amped up. And I was like, buddy, like what is going on today? You seem real happy. And
Right.
he's like, Natalie, I read this article about getting in the cold plunge first thing in the morning, like right after you
First
wake up.
thing.
He's like,
Yep.
I never ever do it. He's like, but I read that it can increase the dopamine response by 800 times.
Yep.
And I was like, well, honey, I believe you. I don't need to read that article. I am looking at the proof
Uh-huh.
right
Right.
now.
Wow, that's
Blew
amazing.
my mind. And
Yeah.
so now I'm like, oh, because of all the things, it's like there's so many things that are so difficult, right? It's kind of where I'm like calling and making an appointment to go see the chiropractor, getting in the habit of doing that weekly. Like all you got to do is show up.
Mhm.
Like it really doesn't take that much time, right? Finding time to exercise 30 minutes a day. What am I going to do? What am I going to eat? A lot of times those things feel overwhelming. So I love things that like go to the chiropractor, get in the cold plunge, even for a minute.
Mhm.
These are little things that can help start getting things in the right direction, start turning that switch so that you actually have more willpower and brain power to go do the exercise,
Mhm.
to purchase the right things at the grocery store, to prepare the healthy meals
Mhm.
because
Right.
you're not in that state of alarm and just survival,
Right.
honestly.
Yeah, exactly.
Right.
I do have a question. So
Yeah.
you're a big fan of the ice plunge. You're a big fan
Yeah.
of the sauna. Now, from what I know, the ice plunge is going to impact the sympathetic system majorly. It's going to spike it up and make you like get that adrenaline hit. And you, from what I've heard, you want to do that first thing in the morning,
Yeah.
so that way you have that spike
Yep.
first thing, and then it kind of just slowly eases down
Right.
throughout the day.
Mhm.
And then some of the other protocols I've seen is where you end the day with the sauna, so that way you're essentially unwinding
Mhm.
to go to
Mhm.
sleep.
Yeah.
What is your take on kind of that protocol, and maybe some more thoughts on your protocol?
Yeah, no, I love that. So first thing in the morning, definitely. Because first thing in the morning, that's when, at least that's what the latest research, gosh, don't quote me on this because I think it was out of Switzerland, the gal that did it. But the best benefit is first thing in the morning because the struggle that your physiology has to go through coming off of that is the benefit. Now, yes, there is great benefit in rotating back and forth between cold plunge
Mhm.
and sauna. However, if we're working in real life, day-to-day activities, it's tough. Like, oh, cool, I have 3 minutes in the cold plunge and then I have 40 minutes in a sauna. I'm going to go back and forth. Okay, I don't really have that amount of time.
Right.
So first thing in the morning. So I prefer, if you want to get the best benefit from what I've read, is it's cold plunge first thing in the morning, and then you allow your body to work back up to temperature. Because again, when we look at sympathetics and parasympathetics, it's okay to engage sympathetics in the short term. That's how we survive. That's how it's intended. We're intended to be in a natural state, balanced between sympathetics and parasympathetics. That way, if we need to toggle, like if we're hiking over Memorial Day weekend in the mountains and a bear jumps out, we need to be able to run for our life and fight for our life. That's healthy. That's how we survive.
Yeah.
But the difference is then it comes back to normal. And that way, if we need to engage parasympathetics for anything, if we come in contact with a virus or something that we need our immune system to work well, that engages. And then we come back down to normal. So that's strength in the short term of running sympathetics. That's healthy. That's okay. Where we're not healthy anymore is when we teach it with chronically stressful lifestyles on everything, is we go too much sympathetics and then it learns to stay there.
Yeah.
We actually wire the brain to run sympathetics too much. So going back and forth between the relaxing and the stressing is actually highly beneficial to the system to be able to do that. But if we don't have time for that, cold plunge first thing in the morning and then anything with saunas at the end of the night is an absolutely phenomenal way to go.
That's awesome.
We actually just talked with one of our guests, I think it was just last week, about this and talking about, he was talking about stress and it being one of the pillars of like, pay attention, take care of your stress. And so I brought it up again and I was like, stress bad essentially. And he was like, I want to be clear. There are certain kinds of stress that are good. And it's exactly what you just described. The short bursts of intense stress versus the chronic never goes away. We're in this constant state of alarm and reactivity.
Well, exercise is no different. I'm like, if you look at an HRV test, the heart rate variability test, and somebody who chronically trains, like HRV testing, actually, if you look at it, like most major sports teams, college and pro, utilize HRV testing for all of their athletes. Why? Because they want to make sure they're not overtraining them. So they have enough time to recover. They want to be able to stress the system out to its maximum amount while still being able to recover and not lock them into stress. That's when they can get maximum gains out of their body while still being able to recover and function healthy at that point too. And so in essence, cold plunging is just, and sauna is just another way of doing that. The same point. And this, again, come back to chiropractic a little bit. Why I love it so much is because it's one other, we consider chiropractic kind of like the glue. Right. All we're doing is entering and helping people who are, maybe that's what they're doing, or maybe their stress and recover is just kids' activities in a given day. We're just giving their nervous system another bump to be able to constantly go back and forth between those two with ease and not get locked into too much sympathetics.
Yeah. So actually that gets me, I'm curious now, kind of going back to a previous question. When you tap someone's spine, and it affects their nervous system, how does that actually affect the parasympathetic system? Like, how does that actually work?
It's the chemical reaction, is my understanding correct? That it's the chemicals of all of the dopamine, the endorphins, and the stress response dropping down, and it's all via chemicals. We thought for a long time it was like the bone out of place pressure on a nerve, and we were moving the bone off the nerve. If your chiropractor is still saying that, there's a little more education behind it now, and it's all a chemical reaction of turning off the nociception, which is bad communication, bad signaling through the body, and reintroducing that proprioception, which is the good communication back and forth through the body. So it's all chemical reaction, a bit structural, but almost all it's the chemicals behind it.
Yeah. They're movement-based receptors. When those receptors are down-regulated, that allow nerves to fire, and the wrong receptors to fire is when things are not moving. And so that's where the power of chiropractic comes in. We're actually making an adjustment. We're actually getting movement pathways to fire, again, the proper receptors to be able to fire, and the nerves go, basically, I'm happy at this point, and I can send great signaling back up the pathways again to the brain.
Gotcha. Because essentially when you tap that nerve, almost is what you're doing, it wants to react. It wants to be able to fire off. And then while it fires off, it's almost like a hose that got like blocked up or something. And when you tap it, it's able to clean out that area.
Yeah, but that's not bone pressing on that. Like you're kinking a hose, which is what people used to think. Yeah. It's like, it's not by any means like that. It's more like fine tuning the tone of a guitar string rather than anything else.
Yeah. So fantastic. Now, that being said, we've touched a lot on the nervous system, but in cases for someone that has like scoliosis or some of these actual spinal issues, would they go to a chiropractor for those types of things? Absolutely.
So that's the other side. There still is a structural piece, absolutely, with it. So anytime we have any vulnerable places in the spine, so a disc herniation, oftentimes people are born with only 4 vertebrae in their lumbar spine or 6, and they have some transitional things happening in their low back. There are some conditions like Ehlers-Danlos, which means you just have some more hypermobility of things. There's a whole bunch of different conditions in the spine. Osteoarthritis will set in and things like that. Anywhere you have an area of vulnerability usually becomes a problem because it's either hyper or hypomobile for a long time. Typically, when we find areas that have been, the word chiropractors look for is subluxation, areas that aren't moving well and therefore affecting the nervous system. When we have those areas of a long time, the body is really smart and it tries to lay down calcium to hold it together. So when you see grandma that's bent over, at the grocery store and can't walk, that's because of years and years and years of structural problems in there where the body's trying really badly to help and protect that area by laying down calcium. And so when we get that osteoarthritis or those bone spurs, people call it in there, those are the different things that, yes, structurally we want to disrupt that cycle. And if we don't get in and manually get that motion in the spine, it will continue to develop. And so that's where we see those scoliosis, the hunching over, things like that as well. Yeah.
Fantastic. So when you make those adjustments, it's like keeping the calcium circulating and not allowing it to like form up and kind of crystallize.
Yeah, turning off that body's response of trying to be protective. Yeah, and that's the way it is protective. Our bodies are really smart. Same thing. High blood pressure is usually an accommodation as well. All of the different things our bodies do is an accommodation to where our vulnerable spots are in our body. Our body is trying to adapt and really be protective as best as it can be. Yeah.
It's amazing what the body does.
It's so crazy.
And it just sounds like everything that you're doing is really trying to be in support of how the body naturally is designed to operate and to move.
Yeah.
Absolutely.
So we want to relieve any of the areas of vulnerability, weakness, stress, things like that, things that aren't moving well, so the body reacts appropriately. Yeah.
If you were going to debunk something that you hear from people all the time about like chiropractic care, what would it be?
Cool. Number one is, I get this quite a bit. It's not necessarily from parents and kids. It's usually our more older population. It's just they're like, I've been hesitant. I'm going to go to the chiropractor. Why? Because I've been told that once I start going, I got to go for the rest of my life. Once I start, I'm never able to stop. And I'm like, and And
like
I'm
a
like,
can of Pringles.
Yeah,
100%.
exactly, right? For sure.
you know,
For sure.
and I try to explain, I'm like, no, it's not that once you start, you can't stop going. It's just that most people choose to not stop going because they recognize that for whatever struggle in their life, in their body that they were experiencing, that once they get things back functioning optimally again, they get back to the top of the mountain as opposed to being at the bottom. Nobody wants to crash and burn again. And so unfortunately the system it's 100% is binary. I mean, like, if it's not getting better, it's getting worse. There's no, the problem fixes, we get a problem fixed and like, cool, we're done. Because if that's the case, it's no different than nutrition. It's no different than exercise. I'm like, if you want to eat properly for a year and get your body back functioning optimally from proper fuel, if you all of a sudden eat terribly, then the system's going to get worse. And stress, unfortunately, is a part of our life. And so if you're not consistently taking, that's why most patients continue to want to get adjusted, is because they know stress is a part of life. We're never going to get away from it. No matter what late night infomercial says, do this and stress is gone. There's always going to be a part of life. And so you're always going to have to manage your body's ability to adapt to that stress load. That's how we stay healthy. So it's a choice. It's not a have to. I tell our patients, especially when we're trying to fix an issue, I'm like, I'm going to lay out a plan of attack that's going to take you from A to Z. And we're going to get your body 100% back to normal function again. And then I promise you, I will make recommendations on what it's going to take in order to keep you there. But that choice is yours at that point. And most people choose at that point to want to continue on and maintain things. So.
Well, and my thought process is like, it's like, do you want to do something regularly for your health to get you on track and to keep you on track and out of chronic illness and disease? Or do you want to wait years and years, not do anything and be seeing a regular doctor, an MD or, general practitioner to treat all the chronic disease that has come up and you're going to have to keep seeing regularly and have medication? Not that it's a cure-all for everything,
Right.
but it's like if there's something you could do now, which is a lot of what we talk about for longevity, if there's something that you could do now to set you up for better and more likely success as you age,
Absolutely.
would you want to do it?
Right.
Especially if it's so simple.
Yeah.
Again, this is like, you call, make the appointment, and show up.
And now it's all text even. I mean, people just text us and say, I got to come this time. And you're like, it's super easy now.
And don't get me wrong. We talked a lot about kids and babies and we love that, but don't get me wrong. We still have our adults and our grandmas and grandpas that we love.
Oh yeah. We like our 3 and 4 generation
100%.
families. We got a lot of them now.
Way better cookies at Christmas time.
No offense to the kids.
No offense to the kids.
There's always a little extra in the kids ones.
But I'm like, I love it because I look at some of our grandparents that we take care of and I'm like, and unfortunately, this is what's sad about the world today is you can tell the ones in life that chose to make the right decisions early on. And they're the ones that are 70 and 80 years old in my office showing me a video of like, hey, I was at the gym and I got a 4-minute plank hold this week.
Oh my gosh.
And they're able to do amazing things. They look vibrant. They're upright. They're truly enjoying the golden years. And then we see the ones that are in the golden years. And what is that? It's like, cool, what doctor's appointment do I have this day? Which 6 pills do I have to take this day for this issue and this issue and this issue? And I'm like, this is just me personally. I'm like, I don't want to be that person. When I get to be 60, 70, 80 years old, I want to be enjoying life. I want to be with my grandkids. I want to be staying active. I want to be like, oh, okay, cool. I'm 75 and I just did an Ironman. I'm like, those are the things that I want to do, but you got to make the right decisions when you're younger to build your system to be ready to truly enjoy life when it's that time.
I feel like in a lot of ways, we've just kind of accepted this inevitability of getting old, meaning being decrepit.
Right.
And that's really sad because it really doesn't have to be, but much like investing and saving for retirement when we're young, it's not often really what we're thinking of because it feels great now. Like I've got enough money now and I'm able to go to the gym now and throw my kids around and play. So you don't really think about it, what you're doing right now to invest in your long-term health and ultimately your happiness.
Yeah.
Because nobody wants to be shut in or have to be taken care of by someone else which eventually probably, it's all going downhill that way. But ideally that's not happening starting in your 60s.
Correct.
No, and I'm like, prime example is when Dr. Lindsay and I were on a chiropractic mission trip in Brazil when we were getting out of school. And I'm like, I had the fortunate ability to take care of this patient who was 99 years old. Wow. And he comes in to get adjusted that day. And I had a translator with me. And he had just retired, quote unquote, 2 weeks ago from his farming job and whatnot. And I'm looking at this guy, no shirt on, right? 6-pack. I'm like, 99 years old. And I'm like, new goals. New goals.
You're not American, are you?
And I'm like, but you look at their life and he's active every single day, right? They grow all of their own food. He's eating
in the
great
sunshine.
food. He's in the sunshine.
Mhm.
He's decreasing the stress load that's going on into his system. He was coming in, he was getting adjusted. And then I know the chiropractor that's there too, and he gets adjusted on a regular basis. I mean, he's doing everything right. And I'm like, look at the possibilities of what our system is able to do when we do the right things over the course of a lifetime.
Right.
And so it was amazing. Like new goals.
Right.
So,
What about for any of our listeners that are listening right now that are like already feeling like, man, it's too late. You know, I'm in my late 50s, I'm in my early 60s, maybe beyond, and I haven't been doing any of this. Like, is there
That's
even a
okay.
point?
Absolutely.
Yeah.
Absolutely. I mean, every single time you get your body to function just a little bit better and a little better and a little better, it's like a snowball effect, right? So
Yeah.
every little thing, I mean, even just starting with a little bit more hydration, getting a care plan from a chiropractor will be important because it's going to take longer when you've had 60, 70 years of stress and issues that haven't been taken care of versus my babies that are 3 days old, right? Like they don't have that built up in their system quite as much. But there's absolutely a point to, starting exercise. I've seen wonderful things. We are somewhat still part of the CrossFit community. And we've seen people go into, different workout programs and becoming so much healthier in their 60s, 70s based on life choices starting then and, reversing a lot of the diagnoses they had prior that they were taking medication for. Yeah, absolutely.
I love that. I was just thinking as we were talking, like it might start feeling like a little bit hopeless for anybody who's listening.
Yeah.
Who's
Oh gosh,
already
no, we've
aging
seen
to
some
be
cool
like,
stuff.
Yeah.
and this is where I start with people, especially if they're in that state. And the study that was done, I can't remember which year it was, but it said the greatest simple change that we can make for the reduction of overall chronic disease, heart disease, cancer,
It's like
diabetes,
70% of it.
100%. I'm like, I didn't want to go that. I'm like, I think it was 56 or 60%, something like that, is a 30-minute brisk walk once a day.
Yeah.
Yeah.
It's the greatest
It's
thing
insane.
ever studied for the reduction of chronic disease. And it's something that we don't need a gym. You
It's
don't
free.
need it's free. And you can get vitamin D and sunshine while you do it and say
Right.
hi to your neighbors and get positive, 100%. And it's a 30-minute brisk walk once a day.
Yeah.
I'm like, who would not want to do that for 60% reduction of chronic disease likelihood?
Mhm.
I'm like, it's huge.
It's amazing.
Mhm.
So
Yeah.
Yeah, I think it all comes down to, and this is pretty common across the literature, is it's just about consistency.
Yep.
It's a
Mhm.
consistency above volume, because you can go and kill yourself in the gym for 2 hours and be like, I'm never doing that again.
Right.
and if you want to work your way up to that, and for the sadistic people that want to go do CrossFit every day.
Yeah,
Right.
right?
Good for them.
Yeah, no
You
thanks.
can go
Right.
punish yourself.
Yeah.
Right.
But just for the average person, especially if you're like 60, 70, just going for that 30-minute brisk walk.
Mhm.
Like there's another book that I absolutely love, Atomic Habits by James
Yes.
Clear.
Great book.
Wonderful book.
Great book.
And I love the concept that he talks about in there, where it's really just those tiny habits of like
Mhm.
putting on the shoes
Mhm.
and just going for that small walk every day is going that is what's going to make the biggest difference in the long run.
Right.
Absolutely. Absolutely.
And like I've said again, it's like so overwhelming trying to take control. And I think that for so long we've associated, eating well and exercising about your physique, about
Mhm.
losing weight and
Right.
being fit, right?
Yep.
And so we so often forget to play into that. What are the other things that are happening? And what is this really about? Like typically if you're like fit and muscular, then like you're healthy, right?
Mhm.
It's a manifestation of the work that
Sure.
you've been doing. It's
Sure.
the visualization of all of that, being able to see it with our eyes. And of course we find that aesthetically pleasing and we all want to have that and be
Right.
that. But it's like we've forgotten, I think that some people, it's like, oh, I want to lose weight. I'm ready to fit into those jeans from 5 summers ago. Like walking isn't enough.
Mhm.
Like if I'm just going walking for 30 minutes a day, that's not enough to help me lose weight. And it's like, well, but that's not the focus and the goal,
Right.
right?
Mhm.
And
Right.
like, again, with things like going to the chiropractor, doing cold plunging, walking for 30 minutes a day, starting to do these things
Mhm.
and what begins to happen mentally, it's insane. I remember I got out of my workout routine last year. I was going through some health issues, gut microbiome dysbiosis, fun
Mhm.
stuff.
Yeah.
And it was so hard for me to work out
Mhm.
because I just had no energy. And then it's like longer goes. And mind you, I've been active in fitness for pretty much my whole life. So like
Mhm.
be in that state and like,
Right.
ugh. And then it was like, I had to be like, okay, movement is about my mental health. That is going to be my only motivation for
Right.
going for a walk and getting to the gym.
Right.
Mhm.
And it was incredible how just, it was like, that's the only reason I'm doing it.
Right.
That was the decision for why.
Mhm.
And it has started to affect every area of my life. Because obviously getting the movement in then impacted the way that I felt. And I felt better equipped and had more motivation and willpower to do these other things, to start eating healthier, to like start ticking off and making these goals. It was, it's just this, like you said, a snowball effect.
Right? And it is. And there's psychology to it too. And like that's what we teach people too, is I'm like, in psychology, it never works if you take things away first. The way that works is when you add things first. And so what do? We add the chiropractor, we add a walk, we add things like that. I don't say, cool, take everything that's bad away from your diet and don't eat it anymore. It's the best way to not have things work. Right? We have to add things first and then the snowball happens. So you're like, cool, I'm walking every single day. I'm adding all these things. I'm feeling better. You're going to start to take a look at the bad food and you're going to be like, yeah, I don't want as much of that.
Yeah.
Why? Because I don't feel good. I can't do the things that I love now. And they'll naturally begin to come off the plate at that point too. But don't take things away first.
Yeah. Well, and I kind of love the idea of like people calling you up and making an appointment, because in a way it's a bit of a disruptor, because it's like people go through their lives and like keep repeating the same unhealthy patterns and keep beating themselves up for repeating those patterns. And they know what they need to do, but they've worked up in their head how much work this is going to take to even get started. But they likely haven't ever thought about just calling a chiropractor.
Yeah.
And I'm wondering what kind of like switch that might flip to just be like, oh, pattern disrupted.
Right.
And like what other kind of chain reaction that might have just to like try something else.
Yeah.
Even beyond, like you said, there's something that's psychological about it. And I'm wondering what kind of impact that would have on a lot of people.
Yeah. And we really try in our office, because we're such a family office. Our team is so good about talking with people. They'll know your name. It's just nice to see a smiling face. But even in our rooms, like we just talk to people. We're just humans, right? Like we mess up sometimes too, but just, in life and make poor choices or whatever. But it's so nice to just be in an office of smiling and wellness and health. And you'll see the other people around you that are like, oh, okay, yeah, look at this other mom. She's got a smoothie with her today, or whatever the thing is, we're not drinking the coffee from Starbucks that's 20 ounces laden with sugar that we all sometimes have. But it's just nice to see some of those healthy changes just amongst the community that happens. Yeah.
I love that.
Definitely. So to kind of wrap up, a couple of things I want to ask about is, one, if someone is hesitant, still hesitant after listening to this whole conversation, is like, hey, I'm actually not quite sure if I want to go in for chiropractic care. What are the pieces of things there's like, hey, it's okay, come on in and we'll see you?
You want me to take it?
Go ahead.
Sure.
Yeah.
So the one thing people always worry about is, number one, is it going to hurt? Number two, how much money? How are you going to be able to help me? Are you going to be able to help me? Those are the kind of the major things. We just tell people to come in and do a consult. We'll talk you through what's going on with your history. Please tell us if you're nervous. That's the other thing. Sometimes people have this thing and they don't want to tell us. And I'm like, it's okay. You may have had a poor experience in the past. There are poor teachers, there's poor, everybody out there, there's poor everything somewhere in the profession. And so if you've had a bad experience, I apologize on behalf of that person. But our goal is really to have that conversation with you, make you feel comfortable. And then we will do all of our scans and know what's going on in your body before we'll do anything. So that's the one thing that really makes it different, is we do a full review of what's going on before we ever go to adjust you. And then we walk you through every single step of the way, what it's going to feel like, what it's going to sound like, what you should expect, what a care plan looks like for you, so that you have really answers to every question before we ever go to adjust you. So you've developed that relationship and that trust before we ever go into adjust. And when we do adjust, like I said, we adjust babies all the way up to pregnant women to grandma and grandpa. And there's definitely different techniques that we'll use for everybody. Some people need, especially like our kiddos that are really high energy, sometimes they don't even get a full adjustment for our first couple of visits, because we're just working on getting that comfort and that trust built before we ever get an actual manual adjustment in there.
Kids are sometimes adjusted in the toy room.
Oh yeah, we're under tables, whatever.
Right. And so it's just, it's very important that my kind of phrase that I use with patients is like, we just got to check first, because here's the thing. When you have something that's going on, I don't even know if I'm the guy to help you yet. And that's why for us, it's always a two-step approach with our new patients, or people that want to know whether or not chiropractic is for them or not. And that's because that diagnostic work is so important, so that I can confidently look them in the eyes and tell them, you're in the right spot and I'm going to be able to help you. And here's what we're going to do. But if we need to have that confidence so that we can look people in the eyes, because it's their life, it's their life. And so we want to make sure that we're able to help them. So
definitely. Fantastic. And so last question here is, do you have any last pieces of advice for our listeners?
Ooh, I love it. Try to reduce your stressors, right? Add in a couple of good things, little hydration, little exercise.
Yeah. The lifestyle stuff is huge nowadays. And that's something that's super, super tangible. even on a day, because if we're checking you and adjusting you so often, you have 23 and a half hours of the rest of the day that you get a choice to make the proper decisions or not. And this is where reducing those lifestyle stressors, because you have a choice as to what goes in your mouth. You have a choice if you want to get out for that 30-minute brisk walk once a day. So I think the lifestyle choices is huge. So.
Well, that's fantastic. This has been a fantastic conversation.
Yes, thank you, guys.
And where can our listeners find you? Like, are you on social media? Do you have a website? If they want to book an appointment, how do they do all that?
Our office is Justice Family Chiropractic. Okay. We're here in Kennewick, Washington, over by the Toyota Center, if you're local. And if you are looking and you're not local here, go ahead and reach out to us. We have some really good directories, I guess, of either pediatric chiropractors or prenatal chiropractors, and then some other chiropractors that do the same scanning technique we have. So we have opportunities to look for someone that's similar to us in your local area.
I love it.
Yeah.
And can they book an appointment on your website? Is that something they have to call?
They can book an appointment on the website. Usually our team will reach back and forth just to confirm, insurance stuff and everything ahead of time. But yeah, they'll be in touch with us as soon as they put something on the website.
Awesome. Sounds like it's really easy, guys, to take one simple step forward in your overall health and wellness. So I would encourage anyone, whether you're local and you can reach out to these doctors here, or you live somewhere else, to take the opportunity to take this step forward in your health. And, one little thing to help move forward and just see the benefit that will have on the way that you feel and the way your life goes.
Wonderful. Thank you so much.
Well, thank you
We
so
appreciate
much.
it.
Such a great conversation.
Thank
Thanks
you
for coming today.
Yep.